Hello, and welcome to the Stroke Care for Community Health Workers Patient Education Edition. According to the Centers for Disease Control, stroke affects more than 795,000 people in the United States each year, and it's the sixth leading cause of death in Minnesota. The disparities in stroke are significant. Each year, approximately 55,000 more women have a stroke than men. Stroke also affects races and ethnicities differently. According to the CDC, the risk of having a stroke is nearly twice as high for blacks as it is for whites, and they have the highest rates of death due to stroke. The racial disparities for stroke in Minnesota is also quite significant. Asian, Pacific Islander, African American, African born, and American Indian Minnesotans die at rates approximately 40% higher than Minnesotans overall. Non-Hispanic Native American, non-Hispanic Asian, and non-Hispanic Black or African Americans experience the highest rate of stroke hospitalizations in Minnesota. Non-Hispanic Black or African American and non-Hispanic American Indians aged 55 to 64 experience hospitalization rates 3 times higher. Before we cover the risk factors for stroke, we need to identify 2 different types of strokes because what happens in the brain is different for each stroke. The first type of stroke is a hemorrhagic, which is caused when a blood vessel ruptures in the brain. The effects of a hemorrhagic stroke are often very debilitating and can be fatal. More commonly, patients experience an ischemic stroke, where a clot stops the blood flow to a portion of the brain. About 87% of patients who experience a stroke have an ischemic stroke. Some patients experience a transient ischemic attack, also known as a TIA, and sometimes called a mini stroke. A TIA is when a patient experiences stroke-like symptoms that completely resolve within 24 hours. While not actually a stroke, it is often a precursor of stroke. The American Heart Association reports that 1/3 of patients who've had a TIA go on to have a stroke within 1 year. Preventing strokes involves managing risk factors. Some risk factors can be changed and some cannot be changed. The factors that increase the risk for stroke that cannot be changed are things like age, sex, race and ethnicity, family history, and if you've had a stroke or a TIA in the past. Although these factors cannot be changed, let's focus on the changes that you can make. One of the risk factors that can be modified is your blood pressure. Long-term high blood pressure can cause stress on the blood vessels and other organs. Keeping track of your blood pressure numbers and making lifestyle changes like eating healthy can help decrease your risk of stroke. Also, taking your medications as prescribed can also help lower your blood pressure and decrease your risk. It causes numerous caustic chemicals to enter your bloodstream. If you can quit smoking, the health benefits start within hours of quitting. Carbon monoxide levels begin to fall, and oxygen levels begin to rise. There are many free resources to help you quit smoking, including the largest in Minnesota called quitpartnermn.com. While they may be the largest, there are also culturally relevant resources like the American Indian Quit Line and the Asian Smokers Quit Line. The websites and phone numbers are here on the screen. Quitting smoking may be a way to become more active. Being more physically active on a regular basis can lower your risk for stroke. According to the CDC, adults should strive for 150 minutes of moderate aerobic activity like walking or water aerobics, or 75 minutes of vigorous exercise like running or swimming each week. Finding safe and effective ways to obtain physical activity can greatly benefit your cardiovascular health. Physical activity can also help you manage your weight. Obesity, or excess body fat, is linked to higher bad cholesterol and triglyceride levels and lower good cholesterol. It can also lead to high blood pressure and diabetes. Finding healthy eating options and increasing your physical activity can help you manage your weight. Managing your blood sugar can also help decrease your risk of stroke. Carbohydrates and sugars in foods become glucose. Insulin helps glucose enter the cell to produce energy. Type 2 diabetes is when the body becomes resistant to insulin, causing a buildup of glucose in the bloodstream. Excess glucose can cause the blood to clot in the vessels. People with type 2 diabetes are 2 times more likely to have a stroke than those that do not have diabetes. Diabetes can also lead to coronary artery disease, also known as CAD. This occurs when fatty deposits clog the blood vessels that deliver the blood to your brain and head. Because of this, it increases your risk for stroke. The best way to manage your coronary artery disease is to control your chronic conditions like diabetes, high blood pressure, and cholesterol. Another disease that can increase your risk for stroke is peripheral artery disease, also known as PAD. This disease causes narrowing of the arteries that carry blood away from the heart to the rest of the body. Increasing physical activity, stopping smoking, and eating healthy are all ways to manage your peripheral artery disease. Also, making sure you're taking your medication and managing your diabetes will also help reduce your risk for stroke. Managing your atrial fibrillation can also help reduce your risk. Atrial fibrillation is an irregular heartbeat that can lead to clots forming in the heart that then travel to other parts of the body, including the brain. The doctors may try to restore a regular heart rhythm or control your heart rate with medication to help prevent clots. Making sure you take your medication as prescribed is the best way to help manage atrial fibrillation. Sickle cell disease is a genetic condition that causes red blood cells to be formed in the shape of a sickle. Those misshaped cells can clog the blood vessels, leading to strokes. Making sure you stay hydrated and follow your prescribed treatment plan is the best way to decrease your risk for stroke. Also, making sure that you and your family know the signs and symptoms of stroke so that you can get help when it is needed. Recognizing a stroke and activating the 911 system is paramount to your successful recovery from a stroke. You and your family knowing what a stroke looks like and knowing what to do if they think you are having a stroke is one of the biggest things you can do as far as strokes are concerned. Identifying potential strokes is as easy as be fast. Looking for balance lost, eyesight changes, facial drooping, arm weakness, and slurred speech. If you see any of those signs, it is time to dial 911. Once 911 has been called, the emergency medical services arrive, and they will perform a stroke scale. All EMS agencies are trained to bring patients to the most expedited stroke care in the state of Minnesota. We have 4 levels of care in our acute stroke care system. The first level is acute stroke ready hospital. They are primarily located in rural areas with lower stroke volumes. These hospitals have the ability to diagnose, stabilize, and treat and transfer most stroke patients. A primary stroke center is the next level of care for stroke patients. These facilities provide acute stroke treatment to suspected stroke patients and admit the patient to a designated stroke unit. They also have the ability to provide rehabilitation services to stroke patients. The thrombectomy-capable centers have the ability to perform mechanical endovascular thrombectomy to a patient with a large vessel occlusion stroke. Comprehensive stroke centers are located in larger cities with much higher volumes of stroke patients. They have the expertise available 24/7 to diagnose and treat stroke patients, especially those that require intensive medical and surgical management. There are 2 primary ways to treat a stroke: medication and surgical intervention. There are 2 potential medications that can be given for a stroke. The first being alteplase and the second being tenecteplase. Both are designed to break up clots in the body, hopefully breaking up the clot in the brain. The second treatment option is surgical intervention, known as endovascular therapy, where a device is inserted through the groin and guided to the clot in the brain, where the clot is then removed. You can receive both types of treatment if needed, often starting with medications at the acute stroke-ready hospitals and moving to a thrombectomy-capable or comprehensive stroke center for further treatment if needed. After having a stroke, there are many things you can do to help prevent another stroke. Staying connected with your provider, including attending any doctor's appointments, and getting any questions answered by your provider is key to decreasing your risk for stroke. Also, making sure you are taking your medications as prescribed and getting connected to resources if you cannot afford your medications. Your doctor may be able to help you with this as well. Resources for healthy food options may also help reduce your risk. And exploring options for regular physical activity, including gyms and parks. Online options for physical activity may also be a good option for some people. There are a number of statewide and national resources for assistance after a stroke, the first being the Minnesota Brain Injury Alliance and the Minnesota Stroke Association. They can help locate resources, including finding local support groups, connections to local rehabilitation resources, and mental health support. They can also provide support to caregivers of stroke patients. The Minnesota Department of Health also has resources located on the website below for medication and insurance coverage. The American Stroke Association is a great place to find resources for stroke prevention, along with the American Heart Association website, which focuses on the life's essential 8 to maintain a healthy lifestyle and prevent heart disease and stroke. Thank you for joining us today. We hope you found this training informative. If you have any questions, please email the stroke team at health.stroke@state.mn.us.